Neck pain and tension headaches go together like peanut butter and jelly, except in a much less cool way. Today we're going to talk about both of these conditions, things that are causing them, and some options that you have in order to overcome them. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy. I'm a sports chiropractor, and our office specializes in the conservative management of musculoskeletal pain and injuries. And one of those things is tension headaches. So let's get into it. Let's first talk about a trigger point. A trigger point is a group of muscle fibers that have stayed in a contracted or a shortened position. Now, when we have one of these spots in the muscle, it can cause tension, it can cause pain in that spot. It can also cause something called referred pain. So these pictures show the little black X is where a trigger point is located in certain muscles throughout the neck. And then the red kind of scatter plot is actually studies they did where when that trigger point in the muscle was palpated or hit with a dry needle, the red spots show where that patient perceived the pain. So what this is illustrating is referred pain. Now, referred pain is just that. It's pain away from its source or in another location. So the combination of the tension in these muscles and how that affects the joints in that area and how they move can cause a pain syndrome. And sometimes that is a very dull, achy headache that we can feel on the sides of the head or behind the eyes or anywhere where you see these little red dots. The upper trap up top here is a common spot we'll see. And you can see that it kind of goes all the way up the neck and almost like a question mark shape all the way to that corner of the eye. And these are common things that we see in the office. And big things we want to do is navigate getting that muscular tension or that trigger point out of there, and then renormalizing good joint motion so that you can get rid of your headaches, get rid of your neck pain, get back to doing the functional things you love doing. The challenge is that most of us in Western society, we are sitting a lot, we're driving a lot, we're working from computers. These are all factors that keep us a little bit more stagnant. If we're stressed, anxious, sometimes we clench our shoulders. All of these muscles up here, when they hold on to that tension, they can create these pain syndromes, whether it be tension headaches or neck pain. So those are factors that are working against us. But the good news is a lot of our conservative measures work really well for these. So that could be a combination of some hands-on muscle work, as well as things like dry needling or laser therapy or chiropractic adjustments. All of these things are incredible at helping mediate some of this pain. But then the important part too is that we challenge that tissue, we get it stronger. So the rehabilitation side of that is how to mobilize that neck well on your own, creating good habits throughout your workday and just throughout your daily activities, as well as strengthening and stabilizing those muscles so that they have the resilience needed to do all the activities that you love. Now, if that sounds something like you've been going through, I would invite you to check out our website at TruMotionTherapy.com, where we have more information, more resources, as well as the ability to schedule an appointment with one of our doctors. And we would love to create a good plan for you that is specific to your goals and the activities that you love. And we want to get you back doing all those things.